Hi everyone. The topic of today's module in the Canine modular course is that of chronic diarrhea, a subject we love to hate, but something that is a very important presentation in small animals because we see it so frequently, and we need to get our diagnostic approach correct in order to achieve the correct diagnosis and therefore choose the correct treatment. So the first thing, as with everything in medicine, is to make sure that we take a good history. There are very specific questions we will need to be asking clients in order to rule in and rule out certain conditions from the outset and give us an idea as to what pathway, with regards to the diagnostic pathway, we should be thinking about taking. So when we think about diarrhea in dogs, the first and most important question we need to ask ourselves is, do we have an animal with signs of small intestinal versus large intestinal diarrhea? Is there any evidence that would support an underlying metabolic disease? Could the diarrhea be associated with dietary indiscretion? Is the animal a scavenger? Is this a possibility that it could be an infectious process? For example, are there other animals in the same household with similar signs, or even do the humans in the household have similar signs? Could it be parasitic? Is the animal up to date with its anti-parasitic treatment? And is there any access to drugs or toxins? Now, all our owners love to think that, perhaps love to think is probably a little bit excessive, but they're very quick to believe that intoxication or poisoning is very common. Thankfully, that's not the case. And more benign causes are far more likely. But asking about the potential access to drugs or toxins still remains very, very important. So first and foremost, as I've said, we need to decide whether we're dealing with small intestinal or large intestinal diarrhea. And it's absolutely vital to differentiate between these two, as the differential diagnosis treatment will be different. But remember, in some cases, animals will have a mixture of both. So if we talk about small animal diarrhea, first of all, the symptoms associated with that are on the left-hand side of your screen. So typically we have normal frequency of passing feces, but the volume that is produced at each occasion is increased. There's no history of straining. There's no history of changed blood or melena. There's no mucus. And often the animal does present with signs of weight loss. Whereas compare that to large intestinal diarrhea, we have an increased frequency but smaller volume of stool. There's frequent straining or tenesmus. There's often history of fresh blood in the stool and mucus, but there's no history of weight loss. But as I say, it's possible that you could have a combination of both small and large intestinal diarrhea together. So we must be asking these questions. We must be interrogating the clients as to whether it's a large intestinal or small intestinal diarrhea. The clients won't understand that. We have to ask the correct questions in order to ascertain whether we're dealing with large intestinal, small intestinal, or a mixture of both. So we then focus on our clinical examination after we've taken a thorough history. And just as with the history, it should be a full clinical examination, not just focusing on the abdomen or gastrointestinal tract. And it really is important we perform a rectal examination, particularly if the animal does have any symptoms of large intestinal diarrhea. We want to assess whether there's any rectal masses, whether the anal sacs are as they should be, whether there's any pain on rectal examination, and whether there's any polyps or any blood on the glove after the examination has been performed. So please do remember to perform rectal examinations on these patients. We then start off with our diagnostic investigations, and that's going to include some or all of the following. I think in any case where we've got an animal with symptoms severe enough that investigations are required, doing hematology biochemistry is warranted. Sometimes your fecal culture and parasitology is going to be the priority if there's a high risk that it's an infectious cause, but probably doing hematology biochemistry to rule out concurrent metabolic diseases and see what effect the diarrhea is having on things like proteins is going to be quite important. And as somebody much wiser than me once said, if you're sick enough to warrant hematology biochemistry testing, you're sick enough to have urine analysis as well. So really, we're thinking of that as kind of our minimum database, as having our baseline hematology biochemistry and urine analysis. It may not necessarily give us the reason as to why the animal has diarrhea, but it will allow us to see what effect the diarrhea is having globally on the animal's body, and also make sure that we don't have any concurrent diseases or side effects that might affect our further diagnostics or our further treatment. We also want to do fecal culture and parasitology. I certainly would want to do things like this if there was a strong suspicion of infectious pathology. So if multiple animals in the same household were showing similar clinical signs, but very important regardless. But one part of the diagnostic process which often gets missed, and yet it's absolutely vital, is the food trial. And this really is a vital step in the diagnostic pathway, and we shouldn't be moving on to more invasive diagnostic tests or more expensive diagnostic tests without performing this, and I'll explain why in a short while. After this, we might want to perform some kind of abdominal imaging. That may be radiography or ultrasonography. I would argue that ultrasonography is more useful in these cases. And also, if there's an indication that we have small intestinal diarrhea and there's potential for malabsorption, testing for TLI, folate, and cobalamin are also recommended. But ultimately, if you've gone through that pathway and we haven't got the underlying diagnosis, or the animal still has symptoms despite supported treatment, ultimately we're going to get to the point where we're probably going to need to do biopsies of the appropriate part of the bowel. And this may be endoscopic biopsies, this may be exploratory laparoscopy, or some way of obtaining that information. So, sorry, I should have said exploratory laparotomy or laparoscopy. So any way we can get those biopsies is going to be possible. There's going to be some cases where endoscopy is going to be better than surgery, and some cases where surgery is going to be better than endoscopy, and we'll cover that in a short while. So speaking first of all of our minimum database, we start off with our hematology. It's unlikely to give us the cause of the diarrhea, but it might give us some little pointers as to which direction we need to travel. So if we have an anemia in our patient, that should start to focus our mind as to whether that's an anemia of chronic disease, which is usually mild and non-regenerative, or whether it could be a gastrointestinal hemorrhage. And in those cases, it might, for example, be microcytic hypochromic. Also, the presence of eosinophilia can be helpful, because an increased eosinophil count is going to be more suggestive of some kind of parasitic or allergic type response. So looking for intestinal parasites, thinking about food allergies, thinking about potential for intestinal mast cell tumours, these all have a place here. And we know that food allergies are very, very common in dogs. So the eosinophilia may help point towards that. I would hasten to add, however, that a lack of eosinophilia by no means rules out these processes.